Hello, it's good afternoon to COVID scientists and warriors. I am Dr. Subhash Hira, a medical doctor of infectious diseases and a public health scientist. I am the moderator of webinar learning series that is launched by the Global COVID Network. This global network is launched because COVID-19 is a pandemic, and the best way to respond to it is by bringing the global actors together. Thus, Sambodhi Research and Communication Organization, Indian Social Responsibility Network of New Delhi, and the University of Washington, Seattle have co-sponsored this global network to foster South-South collaboration and partnerships to share lessons of COVID. I will be very brief to recap the second webinar held on 5th of May 2020. Dr. Zhao of China CDC presented the Wuhan province experience and of COVID emergence, among other things. 2 months of total lockdown with 45,000 infections and 3,500 deaths with a fatality rate of 6.5%. Wuhan province has been reopened for the past 3 months, and COVID cases have now settled down to zero. China has not seen a single case of reinfection so far. Mr. Jaimrug of IIT Bombay, he discussed several models that are being used to estimate COVID trajectory. He suggested adding some variables to infectious disease model, namely Rho equal to beta CD, and to several mathematical models to make them more realistic in terms of predicting the trajectory of COVID. Namely, the variables such as economical and travel integration of COVID-free areas that are linked with high COVID prevalence areas. The second circle on the top row on the slide is for common cold influenza, which shows that for every yellow dot of an index case, a contact, 1.5 contact cases get infected. The third one is Ebola, where for every index case, 2 get infected. And for COVID, it is for every 1 index case, 2.5 individuals get infected, while for SARS, it is 3.5 contact cases that get infected during the total period of its transmissibility. In other words, each of these viruses move with different speeds depending on their own characteristics. The third webinar today is titled Country Responses to the COVID Epidemic and the Diagnostics and Testing. Our first speaker is Dr. Vinay Sahasrabudheji. He has PhD from Mumbai University. He's presently a member of Parliament of the Upper House and president of the Indian Council of Cultural Relations in New Delhi, which is an autonomous institution of the Ministry of External Affairs of the Government of India. He is also the Vice Chair of Indian Social Responsibility Network. He will present the country responses of India to COVID.
It's a pleasure and it's an honor as well to be participating in this webinar, wherein I would try to share my understanding of Indian approach towards this particular pandemic. It may not be a governmental approach essentially, but essentially how the society in India and how our cultural moorings, especially in a way, promote this kind of approach towards the pandemic. Basically, I mean, as you're aware that India was very quick in responding to the pandemic. Major policy decision of the Prime Minister to declare the national lockdown on the 21st of March 2020, I think remained a singularly important decision, which definitely help India halting the spread of this particular pandemic, especially in the hinterland and in the interiors of rural India, especially. This was followed by effective communication by national leaders. The Prime Minister himself has more than 4 times addressed the nation. Lockdown had saved many infections from happening. Currently, only 66,000 Indians have tested positive out of 13 lakh tests done for the corona so far. Rapid response to the pandemic has also contributed to whatever success India has achieved. Number one is the local production of N95 masks and protective gowns. I must also mention over here that the Prime Minister and the leaders in the government have been insisting repeatedly that it need not be a very structured mask as such, but even a simple piece of linen one can use as a face cover, as what we have been describing it. And therefore, popularly, people in India have been accustomed to use some kind of a piece of cloth during the hot sun, especially during the summer. And therefore, this particular habit also has come handy in use of the masks or similar face covers. We have also remarkably shown our readiness of Indian vaccine production companies to undertake large-scale production of COVID vaccines when they were designed. Another important factor is the role played by and the role that is being played by Ayush Ministry, which is a dedicated ministry for traditional Indian medicinal systems, including Ayurveda, Yoga, Unani, and Siddha, and also homeopathy. And all these pathis, in a way, have come together. All the practitioners in these different disciplines of medical science have come together, and they are also helping the government in a very significant manner. There is some kind of a migration that is happening due to the governmental efforts of providing vehicles, including dedicated train services. It is also being regulated very remarkably, I would say. And now that the third lockdown period is about to come to a close in another 4 or 5 days, I'm sure the nation is preparing itself with the help of the government for opening up. And as what the Prime Minister had indicated, that we are here to protect lives, but we are also here to provide livelihood opportunities in requisite numbers to those who are likely to be facing unemployment and issues about livelihood as well. We have to be sensitive towards each other. We have to understand that we are fighting against this disease and not fighting against those who are affected by this disease. And therefore, physical distance, yes, but a complete no to any kind of emotional or psychological distance.
Good evening, everyone. Let me start my few slides first about Cambodia. We go through the slide, and if necessary, later on we can discuss in more details. Before moving to the preparedness and response to COVID-19 in Cambodia, let me also briefly share 2 slides about the basic of SARS-CoV-2 transmission. Just to highlight that from infected person through coughing, sneezing, and breathing and other like talking, then the droplets can get out from that person and can land directly in nose, mouth, eyes, and possibly lungs of the other people. And the other way around, it's possibly that if they cannot land directly on another person, it can also fall on surface or any object that the other people can touch and can get infected. And there is also a small evidence around another possible way of transmission is through aerosol, for which the droplet becomes smaller and spread in the air, which is roughly less than 5 micrograms. That is only happening in specific circumstances or setting, for instance, many medical procedures in the ICU room. So just to highlight that for the first intervention, perhaps the most important we can highlight is the face mask. This is a very important one, and Cambodia have took that seriously since the very beginning of the epidemic, the outbreak. So the Prime Minister have announced publicly that we have to put the face mask. It does not mean that the mask, the surgical mask or any other mask, but the face mask. And in Cambodia, we have a traditional Khmer towel. We call it kroma. It's also recommended to be used for any person who feel that they are sick or having common cold or cough, have to cover their. And then the other way, it's easy to talk about the prevention for the first way of direct transmission is to have the physical distancing or possibly combined with the personal protection equipment or exposure. And then for the surface and object contact, the easy measure and very commonly known is the hygiene, mainly hand hygiene by washing hand properly.
Welcome all to AIMS Bhopal. My greetings, my colleagues, my faculty, my students. They send greetings from AIMS Bhopal. Now, as we know that from microbiological point of view, it is very important that we should know that what coronavirus is, which causes this, causing this epidemic. So this is a very small, tiny RNA virus, and it belongs to coronaviridae. It has many family members in this, about 39 family members. So many of the people might be thinking that it is something new. No, it is not something new. There are several colleagues or members of the coronaviridae we know of, but of course, this got mutated from the SARS coronavirus, and that's why many of you must be knowing that it is also called as SARS-CoV, that is coronavirus 2. So the coronavirus first is called as SARS because it came mutated from the SARS coronavirus, so that's why it is called SARS coronavirus 2. This is very, very tiny virus, as most of the viruses are, like about 120 nanometer only. Peculiar thing of these coronaviruses, all for that matter, that they are having club-shaped glycoprotein spikes on the envelope, which you can see on the right side of this slide, but I will show you a little more on the next slides. And that is the reason that it is known as crown-like or coronal appearance, and then they are all called as coronaviruses. Now, as I said, that they are about 39 viruses, but I would like your attention here that there are alpha, beta, like here you can see this is alpha family, and subfamily, this is called coronaviridae is the family, and then these are the subfamilies. So alpha coronaviridae, then beta coronaviridae, gamma and delta. This coronavirus belongs to this here. You can see here, so SARS and then 2019 coronavirus. So this belongs to subfamily of the coronaviridae, subfamily beta. So this is important, that how many of the people they are having many questions in their mind that from where it came. So it obviously it is very close to the coronaviruses of the bats, and there are many other coronaviruses in various animals. So wild animals, they harbor many types of viruses. One of them are coronaviruses also. So it is important that sometimes whenever I talk, of course today's talk is not on the public health and social changes or environment, but whenever I get opportunity, I also talk on the environment and changing earth. But today is only on diagnostic, but one word definitely I would not leave this opportunity to without saying that obviously the environment is changing and we are destroying our environment, and then probably some of the regions they can be attributed to environmental invasion by the human beings. Now, as I was saying, so here these are the, if you can see, these are the spikes. So these spikes, they are, if you can see, like if you see old kings, so this is crown-like things, it appears. And then here you have the membrane protein, nucleocapsid. Here, this is the RNA, and then there are some other antigens also. They hemagglutinate. So this is important to understand that you might be reading in very social media, newspapers, and many other things that the coronavirus is causing embolism or thrombosis, means coagulation of the blood. So that is also one reason that this is because of this heme agglutinin antigen. So this is also very, very important. And then of course envelope proteins. So these are the very important structures, substructure, even though it is very tiny, but it has many constituents which are very, very important for pathophysiology.